Okay, so I will be focusing on the bones and the muscles of the shoulder. So to start off with, there are 6 bones that play a vital role in the shoulder. So there is the clavicle, which is the collarbone, the scapula, which is kind of like by the armpit area, and in the back of it as well. And then there's the humerus, but the humerus really doesn't play a vital role in the insertions and the origins of the shoulder muscles. And then there is the coracoid process, acromion, glenoid cavity. So those are those 6. Next, we have the muscles. So I'll start off with the anterior muscles first. So there is the subclavius, which inserts at the clavicle, and it originates at the first rib, and its function is depression. So that's good posture, you're going down like that. And then there is the pectoralis minor next, and their origin is at the 3rd to 5th ribs, and it inserts to the coracoid process of the scapula. Its action is depression at the scapula and elevation at the ribs. So elevation is simply just the opposite of depression, so that's when your shoulders go up. And then we have serratus anterior, which originates at the first right ribs, and it inserts along the superior angle, medial border, and inferior angle of the scapula. So it has a lot to do with the scapula. And its job is protraction at the scapula and elevation at the ribs. So protraction is, so for an example, if you're doing seated row, it's when your arms are like this. It's in like that Superman position. I'll go into the opposite of protraction in a little bit with the posterior side, because it plays more of a role with the posterior side than it does the anterior side. So, to start off with the posterior muscles of the shoulder, there is the trapezius, which originates at the lateral third of the clavicle, the acromion process, the scapular spine of the scapula. So those are the origins, and it inserts the medial acromion superior border of the scapular spine. And its actions are retraction, elevation, and depression. So retraction, again, is like the squeezing of the shoulder blade. So it's when you're pulling back from the seated row. Next, we have the rhomboid major, which originates at the spinous process to the thoracic vertebrae and inserts at the medial border of the scapula. So a lot of these muscles have a lot to do with the scapula. And then its job is inferior rotation at the scapula. So it's rotating inferiorly. And then there is rhomboid minor, which originates at the nuchal ligaments and spinous process of the C7 to thoracic 1 vertebrae, and its insertion is the medial border of the scapula. The next one, I have a picture of a neck, so you can see that it might be a little confusing because I didn't really touch on a whole lot of like neck anatomy. But the sternocleidomastoid originates at the sternum and the clavicle, and the insertion is the mastoid process of the skull. So it is a part of the shoulder, and it involves rotation, so moving your head like back and forth like that is the sternocleidomastoid's job.